Hey, everybody. Welcome back to the Beat podcast here at Vive in Los Angeles. Today, I have the privilege of hosting Ann Louise Puopolo, Chair of Customer Advisory Board at RLDatix. Ann Louise is an accomplished and highly respected safety professional and has held many prestigious positions, including Vice President of Enterprise Patient Safety and the Enterprise PSO LLC at CVS Health until her retirement in 2020. And Vice President of Patient Safety for CRICO, Risk Management Foundation of Harvard Medical Institute. She's doing incredible work in this space. I'm so excited to have her here on the podcast today to share some of her thoughts around big challenges in the industry. Ann Louise, thanks for being here.
Thank you for having me, Saul.
It's a pleasure to have you here. And so we hear all the time that healthcare is facing a staffing crisis. What does that look like on the ground?
Yeah, that's a really great question. We definitely are in a staffing crisis. There's no question about that. But the contributing factors around it aren't new. I think there's a misperception that COVID created the mass exodus and the burnout. In all honesty, it was there well before COVID happened. COVID enhanced it. Mm-hmm. So if we sort of focus our energy really when we talk about workforce and staffing, the reality is nurses are our biggest asset. And nurses have constantly been in a position to do more because they're so good at what they do. And in many respects, they're their own worst enemy in this space because they take on more. And a lot of the functions they're doing are probably not really working at the top of their license. And so as a result, I'm not saying they've burned themselves out, but that has been a contributor that they're so capable. And for that reason, they are kind of the jack of all trades.
Yeah, it happens a lot. And that's interesting, right? I mean, a lot of people do point to COVID as the reason, but you're saying it accentuated it.
It accentuated. I think physicians and nurses have long been burned out for a variety of reasons. I mean, the administrative burdens in practicing in a clinical setting, we think mostly about hospitals, but there's a lot of different clinical settings, and there's a lot of stuff that people do that isn't really necessary, but has become essential to getting the job done. And a lot of those things could be automated in ways that could be helpful. Documentation, medical record is the single source of truth on patient care, but is enormously burdensome. We've made no progress in that space in terms of automating the efficiencies around documentation. And quite frankly, shame on us, right? That's something we should have been working on. And, I don't like to be down on anything, but technology hasn't always been our friend. So with the existing systems in clinical settings, there's a lot of toggling between systems and very little that's fully integrated. And therefore, there's a lot of time spent working within different systems of care that probably would serve us all better if they were more integrated. So I think there's a lot of things that are contributing for sure.
Thank you for that, Ann Louise. Can you share some of the most exciting technological innovations that you think could significantly improve patient care and outcomes?
Yeah, I think we're at a time in healthcare where we really have to step back and evaluate how to really problem solve tangibly. And I think staff and patients need to be always the single source of truth and the focus. And so anything that we can do to optimize how we leverage our workforce and use them smartly and use all of the insights that we have about them is only going to make for better patient outcomes. So as a result, I think it's time that we really try to solve at the local level and think about how to use data and analytics to help inform where there are opportunities to bring the right provider to the right patient at the right time. And at the same time, a healthcare organization reaps the benefit of having insights that they can act on and leverage that will help them optimize care and at the same time have economic benefits that they were not aware of without using this sort of insight that the data allows for. So I think this is really sort of a pivotal moment to address the healthcare staff shortage in a way where we can optimize the resources that we have if we're doing things better.
Yeah, and you mentioned this disconnectedness between systems. Do you want to comment more on that and the importance of the integration of being able to do that?
I mean, I think the term of art, I'm not a technical person, is this notion of interoperability so that we aren't leaving one place to go to another. Well, that's 4 or 5 more steps that's taking up valuable time And for a clinically licensed person, that's not a very good use of their time.
Totally.
So where are the impediments in bringing things together in ways that can bring more value, more productivity and efficiency, and at the end of the day, safer healthcare and better patient outcomes?
Yeah, well said. I appreciate you going there. And how do you see digital transformation reshaping healthcare delivery in 2024? And what are the main challenges and opportunities this presents?
Well, I mean, I think it's an exciting time. Let's start with that. And I think there's there's a lot of things that can be done on a variety of levels. So I think from a leadership level, messaging to patients and families and staff that safety is important at both the caregiver level and at the patient level, and using a scheduling asset through the data analytics and insights could be enormously helpful in telling patients and families and providers, we care about you. You know, we care about getting the right patient cared for by the right provider at the right time in a setting where not all the patients are equally as sick, but there's some balancing of acuity. So, I mean, that's a great message for leadership to get out. We care, okay? Then, you know, and it's really a cultural message in many respects. And then from a provider perspective, this is really where the rubber hits the road, right? If providers can manage their own work-life balance and have the ability to schedule themselves and have the flexibility and the autonomy, you're going to get more satisfied providers. And hopefully the end result is they're less likely to leave because they feel like they have control of their own destiny. And I think that's incredibly important and coming at a really critical time. Again, I think I talked about data and analytics. It's crucial for leadership to be able to make these decisions about how they staff and how they use the resources they have to the optimal level. And without the data and analytics, we're really flying blind. So I think that that's really an important piece of insight that we'll be getting as time evolves.
Yeah, thank you, Ann Louise. And it's having that data to make informed decisions that really starts to connect the dots and gives people more satisfaction in their day-to-day and more control.
You bet. That's what it's all about. I mean, the nursing profession has unfortunately long time thought that throwing more money at people is what satisfies people. But in fact, being respected and valued and having control over one's work-life balance, I think will speak volumes. And it will create a culture in an organization where providers feel like they're being cared for as well so that they can care for patients safely.
That's big. So some of these things, hospital, they could start it today, but what does the future hold? What are your hopes for healthcare 2, 3, even 5 years from now?
Yeah. You know, I think we have a lot of talent right where we're at. And I think looking to nursing specifically as innovators to help solve some of the problems at the health system level, at the local level, whatever the level, I don't think we leverage the talent we have to be part of building the solutions. And so in many respects, I would love to see more emphasis played on how to mentor people to be part of the problem solving, right? And reward them for their contributions in that way. I think that would be really great for the culture as well.
That's really well said, Ann Louise, and making sure we include nurses in how these decisions are being made, what technologies are being implemented is, I think, a huge answer for many of the listeners to consider. Look, this has been a fascinating conversation. I really appreciate you sharing your insights. What closing thought would you leave the listeners with? And what's the best place they could reach out to you and the team at RLDatix to learn more?
Sure. I mean, I think at the end of the day, the data and analytics and insights that leadership will have as a result of looking at their staffing intelligence will bring enormous value to the providers who are caring for these patients and enormous value to the organization who is accountable for making sure they're delivering the highest quality and safest care. So I really think that the focus on the data and analytics becomes really pivotal to the future state.
Love it. Great way to leave us. And then where can folks go to learn more?
Sure. You can come to us at RLDatix. I can be reached at ann.puopolo@rldatix.com. I'd be delighted to take anybody's questions and see if I can point you in the right direction.
Amazing. Ann Louise, thank you so much for being with us today. This has been a lot of fun.
Great. Thanks for having me, Saul.